Moving on to our next speaker for today, and her topic will interest a lot of the attendees and panelists over here. She is Dr. BHANU Sharma. She is the resident physician at Savikalpa Sciences. Her topic throws a light on the awareness on the role of endocannabinoid system in promoting homeostasis in growing. In this discussion, she's going to dive deeper into the understanding how phytocannabinoid molecules such as THC, CBD, and ZBN can play a crucial role in improving sleep by rebooting your circadian rhythm. Her topic for today is Sleep Well to Keep Well, Hacking Sleep with Cannabis Medicine. Over to you, Dr. Bhanu.
Yeah, hi. Good afternoon, everyone. And am I audible, Karishma?
Yes, you're audible.
Yeah, thank you so much, Dr. Karishma, for introducing me. And thank you, everyone, for joining me in today. So, as you have mentioned that the topic of discussion is sleep well. So today I am here to educate people and to share my knowledge how cannabinoid medicines can actually help you in getting a good sleep, how it can actually help you in improving the quality and the quantity of the sleep. I'm just sharing my screen.
Yes.
Yeah. So
Yes.
is my screen
yes, your screen is visible,
Yeah.
and you are clear as well in terms of audio. Please go ahead. Is there an issue?
I'm not able to move my slides.
Okay, I'll do that for you. Don't worry.
All right. Thank you.
I'll share the screen.
Thank you so much.
Side. Yeah, you'll have to unshare the screen so that I'm able to share my screen. Okay. Yes.
Is it fine, Dr. Karishma?
Yes. Can you see my screen?
Yeah. So I think we all have gathered here to promote that sense, like what actually can help people getting the optimal health. So optimal health cannot be achieved without a good sleep. And we all know the importance of sleep, and most of us are the healthcare professionals, so we know what exactly the sleep does for us. So I'll not get into the more details, but just touch upon the major points. Like, it helps when you sleep, your memory consolidates, your brain detoxifies itself, it supports your immune system, metabolic functions like appetite. It helps in preventing the weight gain also. It enhances your cognitive performance and creativity. When you sleep good, your focus improves. And basically, it is more about the physical restoration of your entire physiology, and it helps in regulating the hormones. So, in short, if I say that sleep basically, there's no substitute of sleep. There is no alternate to sleep. Now, what exactly are the causes of insomnia? We know that the mindless usage of the gadgets, overuse of the gadgets, and people have been more into the caffeine intake, alcohol intake, not even keeping this into the mind that when they are consuming and what exactly, how badly or negatively it is going to impact their conditions. Of course, there are the other ailments also, like there are the mental health issues, the physical problems are also there, which are adding to their problem. And in current situations, especially post-COVID, what I have experienced is the anxiety, stress that has contributed to the sleep deprivations. And also, yesterday, Dr. Ruhi was explaining it to us that how the bad habit of not sleeping at the right time or the disturbed sleep, it disturbs your circadian rhythm. So actually, majorly what I see and what I have understood from my experiences is that this casual behavioral problem, like what if I'm sleeping at 2 in the night? What if I'm sleeping till 9 in the morning? How it is going to affect, because I'm completing those couple of hours which are actually important for my sleep. So when you are sleeping, when you have this irregular sleep habit, it will just throw away your circadian rhythm and will cause a lot of issues into your system. So these are the causes majorly, and of course the age factors and the pain can also contribute to the problems like insomnia. Now, what are the impacts? what are the benefits if you're not sleeping properly? So of course, when you're not able to sleep properly, it will not only negatively impact your hormonal balance into your system, but also it will negatively impact your emotional stability also. As I have mentioned, that when you have good sleep, then it actually help in catering these benefits to you. But if you're not sleeping well, then it will create more inflammation, and we see that the people get prone to the cardiovascular diseases, and they get diabetes or diabetic also. Now, there are various ways of management. We see there are the various kind of pills in forms of oral medications. There have been supplements also in the forms of the herbs. There are various kinds of oils available in the market, which do help people. And of course, the meditation, it's a very good tool wherein people can, which can help people in getting a good sleep. But today, I'm here to help you out how cannabis medicine can actually help you in getting a good sleep. So, how cannabis medicine can help you to understand this? We need to know how need to learn about endocannabinoid system. Most of you, or we haven't read about in schools and colleges, but yes, we do have a system present into our body that's known as endocannabinoid system. So, next slide, please. Yeah, so this endocannabinoid system is a cell signaling system, and every mammal has this system present into their body. The main function is to maintain the homeostasis. It actually brings out the equilibrium that the body and every human being, everyone is actually trying to achieve a balance into their system, right? When you are into balance, that is a state of health. So this system actually regulates that balance. Then yeah, so it actually helps in regulating the very important physiological processes also, like mood, your sleep, your appetite, the pain and immune system, and also the circadian rhythm of your body. Next slide, please. Yeah, so this system, sorry, a slide back. Yeah, so this system has majorly three components. One is the endocannabinoids, which body itself produces. Second is the endocannabinoid receptors, and third are the enzymes. Dr. Karishma,
Can
the
you see
previous slide, please.
this one?
Yeah,
Yes.
thank you. So what happens is whenever your body goes into how this function, this comes into an action, or how it helps you in achieving this thing. So these are the major three components of this entire system. Whenever the body goes out of balance, or there is any physical or mental cue which affects the equilibrium of its internal environment, the body in itself will produce these endocannabinoids. And these and in our body, we have two kind of receptors, that the CB1 receptor and CB2 receptors. So CB1 receptors are present on your central nervous system, that is your brain and spinal cord. Every cell surface has these receptors present. So one is the CB1 receptor and the second is a CB2 receptor. So CB1 receptor is majorly present on your peripheral nervous system, and CB2 receptors are present on your immune cells and the peripheral nervous system. So then there are the enzymes also. So when whenever there is any kind of equilibrium imbalance into your body, to maintain or to attain that equilibrium, body will produce the endocannabinoids, and these will go interact with the endocannabinoids and will regulate the processes which I have mentioned earlier. So once these endocannabinoids have performed their function, the enzymes will come into action and will remove these endocannabinoids out of your system to avoid the overcorrection. So this entire thing just functions in a way of a lock and key model. We have a lock and we have a key. So are they able to perform any kind of action? No, they are not. Together, when they come, they will perform some action. So to understand this even better, see, if like, for example, if you have any kind of inflammation into your body will produce the endocannabinoids, and they will go interact with the CB2 receptors because they are present on the immune cells. They will go interact with those CB2 receptors and perform the action and help help our body in bringing down the inflammation. So this is the way the endocannabinoid system is working. So how cannabis actually can help you out. So as I mentioned that the endocannabinoids in the body perform the action like this. So cannabis is a plant which have different kind of active compounds. More than 160 cannabinoids are present into it, which goes into your body and works in a similar way. The cannabinoids which our body is producing, they will act in a similar manner. They will act and interact with the receptor just in a similar manner, the way it was working. So when we talk about this cannabis, we see that these cannabinoids, the major ones they are present are the CBD, THC, and CBN. They when they go into your body, they synergistically work on your system and carry out the functions. So when you're not able to sleep well, or whatever the causative factor is there, your circadian rhythm will go out of balance. So once things goes out of balance, this system, endocannabinoid system, will come into the action and try to achieve that homeostasis. Now, what happens when you take this cannabis medicine? It helps you in improving your sleep onset. It improves the REM sleep. It helps in getting you a better quality of sleep. And if I say that overall it improves the sleep architecture, that I think that is the best picture, or this is the how I can just summarize it, that it actually helps you in improving the sleep architecture of your. So, as I mentioned, that this cannabis has the active compounds which goes into your body and just corrects the things which are not helping out. So, the major active compound it has is the THC. So, THC basically has the sedative effect. That means when you consume this, it will help you in falling you sleep easier. And one more thing is that we see that the people who are suffering from sleep apnea. So we have seen the research. There are so many researchers which actually help us, which has just proved this thing, that when you sleep, it actually eases the breathing during sleep. So it has come out to be a very potential therapy for the people who have been suffering from sleep apnea. Also, we know that the people who have been suffering from ailments like post-traumatic stress disorder, they have undergone some kind of traumatic event, which they see into their, which they dream out every night or most of the time in their dreams, and this which actually doesn't sleep allow them to sleep. So they have a very frequent and disturbed sleep because of those nightmares. So now what happens is this THC has the ability to reduce that REM sleep. REM sleep is that sleep wherein people dream. So once this we are able to shorten the length of this REM sleep, the people will not dream that much, and it can be a very effective medicine for the people who have been suffering from post-traumatic stress disorders. Next. Now the another chemical compound which is present in cannabinoids, that is the CBD. Now CBD helps in calming down the nervous system. It is anti-anxiety in property, and also it has the property that brings down the inflammation of your body. So we can say that the people who are not able to sleep because of the constant chattering of their minds, because of they are into the anxiety, this medicine can help in bringing down that anxiety, and people can sleep even better. And also researchers say that it has an ability to improve the REM, the quality of the REM sleep. Then is the CBN. CBN again has a sedating effect, and we see that when people consume this, it actually helps in decreasing the sleep latency. That means the people are able to sleep faster. It is a good solution for those people who actually come and reach out to us, that especially the old age and the elderly people reach out to us, and they say that we have been constantly tossing on the beds and we are not able to sleep properly for the hours and hours. So for them, this could be a good solution. Now, the mechanism of action, as I have already mentioned, that it goes and interact with the with the receptors. So we know that when we are into an action and when we are into the wake, the body consumes, when we are awake, the body consumes ATP to utilize more of energy, and as a byproduct, adenosine is produced into your system. So these cannabinoids will go and interact with the receptors. So the people who have a habit of sleeping daytime naps and who sleep very late in the night, so what happens is adenosine, this level of the adenosine gets disrupted. So when you consume this medicine, it will go and interact with the receptors, and then it will send the signal message to increase the level of the adenosine into your body, and it will promote good sleep. And at the same time, it will go and inhibit the release of the glutamate, the neurotransmitter which promotes the wakefulness. So I think this mechanism is pretty much clear that how it actually helps you in getting a good sleep. So at the same time, it is increasing the sleep promoting chemical into your body, and at the same time, it is promoting it is inhibiting the release of the neurotransmitter which can actually promote the wakefulness. Next. So I think I have answered this thing. We are pretty much clear that how the THC can actually reduce the REM and can help the people who dream, especially the people who have been suffering from the ailments like PTSD. Next. So this cannabis is nothing new. Since ages, it has been widely practiced and prescribed by the Ayurvedic physicians. So to understand how Ayurveda practitioners, what was their perspective and how actually it had helped them out in benefiting their patients, we need to understand and learn two basic principles of Ayurveda. One, your mind, body, and soul are one. They are not different. If anything is disturbing your mind, your mental health, that will negatively impact your physical health. And anything which is affecting your physical health will negatively impact your mental health. So both these things are one. Second thing is that its body is not just about your skin, blood, and your fat or the bones. It is much beyond. It is run and governed by the energies, the three major governing energies, Vata, Pitta, and Kapha. So anything, maybe a lifestyle disorder, or maybe whatever the causative factors whatever the reasons there are, and which is actually disturbing this equilibrium of the energies, the Vata, Pitta, and Kapha, it will create an inequilibrium in your internal environment. Once this happens, you fall into that will create a state of unhealth. When these three energies are in a state of equilibrium, that is considered to be health. So like people who are into the practice of getting very late, sleeping very late in the night, who are very anxious, whatever the reasons are there, once this Vata goes out of balance, it will imbalance both these energies. As you can see that in the slide, it will just throw it will just create an imbalance into your system. The Pitta and Kapha will also goes out of balance. So and once the Vata is aggravated, it will cause pain in your body, it will cause insomnia, it will cause agitated mind. And all these things contribute to insomnia. So Ayurveda says that we need something which can bring back the Vata energy into its position, which can just bring down back to its normal state. So once it will be at the normal state, the rest of the energies will come into the equilibrium, because that was the one which has actually brought an inequilibrium into your entire system. And we need something which can bring down the pain, which is one cause. We need something which can work and address your agitated mind. So cannabis has that ability which can actually bring down or the Vayu into the aggravated Vata at its normal pace. So So this is how it was used, and because this cannabis has a property of, it is basically hot in nature, so it will bring down the Vata imbalance. Once it will be balanced, the rest of the energies will come at this into the balance and the equilibrium. The desired equilibrium will be attained. It will bring down the pain, it will improve the sleep, and it will calm down the anxious mind. So this was the perspective of an Ayurveda, and this is why it was very much widely used in their prescriptions. So now when we know this is a problem and this is a solution, so my organization, Savikalpa Science, has brought this out in a very good form, has introduced a very good formulation and packed it in a bottle named as Shunyata Calm. So the beauty of this product is that it has used the full spectrum cannabis. So full spectrum cannabis means when whatever the natural compounds which are naturally present in the leaves are present into this cannabis in this, and it has been processed with the oils to improve the bioavailability, so that the body can it improves the bioavailability once it goes into your body, right? So when we talk about this, so I always ask my patients and to just not so whenever we talk about it as a solution, I always ask my patients to just maintain that sleep hygiene. One or two things as a practitioner, healthcare professionals, and when it comes to the patients also, I always ask my patients, so don't think that it is a sleeping pill or it is a popping pill. It will not work in that way, because this is something which will go into your system, which will work on your circadian rhythm, which was thrown out of you because of whatever the reasons. It will go and balance that entire system. Don't expect it to be a popping pill. You take it and it will go and work on your system. No, it doesn't work like that. It will go attain that equilibrium, and slowly and gradually it will help you in sleeping. And also not just this, it is not just about the helping you in terms of sleep. We have seen that the underlying cause could be the PTSD, underlying cause could be the anxiety, and the compounds which are there present into it, they addresses the root cause also. Why this medicine root cause, and it is working on those underlying root causes also, why people are not able to sleep well. So and two or three things which people should take care while consuming this medicine is, one is, do not mix this medicine with anything. It is an oral medication. Do not put it under the tongue. And patience is the key. If you think you take it now and it will help you now, no. And then the next day you increase the dosage. It will not work like that. It will slowly, gradually go and work on your system, correct whatever has gone out of balance, and then will help you in getting a good sleep. Second thing is that the key to this is to go, titration is very much important. What happens is we actually advise our people and prescribe. When people come to us, we ask them to maintain that sleep hygiene, and also start with the lowest medication, lowest doses. And as in how we ask people to see and feel how improved their sleep is. And if still after some time people don't feel that improvement into their system, then we ask them to increase the dosage of the medicine, because this is the only way, and this is the only way how a cannabis medicine should go into your system. It's not like that today you start with the 3 drops and tomorrow you're increasing the dose. No, it doesn't work like that. It will go correct, interact with your system, and will bring the things back at its normal state, normal pace. So after when people come to us and we prescribe these medications, we see the very good results. People, it has improved the sleep. It works on their anxiety levels. These and various side benefits also, we see that it helps in reducing the pain, also brings down the anxiety also. So very encouraging results we have seen of this medicine. And since they have a very so just since these were the very much benefits we have seen, so we are introducing our roll-on also as a formulation, and we would be just I think we are hoping to launch this in the first quarter of 2024, so so that the people can sleep well properly and keep themselves well. So this was all my piece of knowledge with this cannabis medicine, my experiences, and now I'm open for the questions.
Thank you so much, Dr. Bhanu, for enlightening us with medical cannabis, is what I would say. There are a couple of questions, though. I'll just answer. I'll just give you one question. Apart from sleep, what are the other benefits of cannabis? Is one question. And are there any drug interactions that we need to check, or we have to take it empty stomach, or how is the dosage that needs to be given? So that is the question.
Yeah, that's very important. You have to take it post meals. It's oral. Do not put it under the tongue. And one more thing which is very important here is people what does is they try to mix it in something. No, it doesn't goes like that. So orally post meals, and the only dosage which doctor has prescribed, because doctor will understand your physiology, doctor will understand the root cause behind why this is happening, and then the doses is suggested. And when we talk about the side effects, see, people tend to experience this that after consuming this, at some point of time they feel a little bit of drowsiness the next morning, and a little bit of dryness in the mouth, which is a temporary thing and which will subside in some couple of days. So they have to be very, very patient. So that's what I'm saying. When you are on the cannabis medicine, patience is the key.
Okay.
And we haven't seen any kind of drug interaction, but yes, whenever whenever the patient is consuming any kind of medication, they should actually report to the doctor that yes, we are doing this, so that the frequency could be decided like that. Desired time interval between the two medications could be like if patient is on a hypertensive medicine, then of course we can decide what the time interval between the two medications should be kept.
And what are the other things that it can be used for apart from sleep? As you said that it can be used in pain, bringing down the anxiety as well. Any other severe gut dysfunctions or any other autoimmune conditions, can this be used, or is it a no-no?
No, we can use it because, as I have mentioned, that it brings the balance. One thing is the pain. It could be neural. We have seen very good results in the patients who have been suffering from neuropathic pains, like in terms of the joint pain, osteoarthritis, pain because of the sciatica, the involvement of where the nerve involvement is there. It does work very wonderfully. It works on the anxiety. We know whenever you have any kind of anxiety, it will add on to the other problems also, like insomnia, one cervical. It could be there, and whenever you enter into anxiety, it will disturb your gut also. And we have seen very good and encouraging results in the people who have been suffering from ailments like irritable bowel syndrome, because irritable bowel syndrome is just not a gut issue. It has a lot to do with your it is actually
Systemic
a
issue, yeah.
psychosomatic ailment.
Psychosomatic,
So
systemic
it will
issue.
bring down the anxiety, and at the same time it will work on your gut motility also.
Thank you so much, Dr. Bhanu, for joining us. And I guess everybody has the information on their products as well. You will get a notification for the same as well. There are certain questions in the chat box. I would request you if you could answer some in the chat box itself. Thank you so much for joining us.
Thank you so much, doctor, and thank you everyone. And I'll just answer the questions. Thanks.
Thank you.